In individuals with insulin-treated type 1 or type 2 diabetes mellitus, hypercholesterolemia is a major risk factor for macrovascular complications. Statins lower low-density lipoprotein cholesterol, or LDL-C, and reduce cardiovascular events in these groups, yet many individuals still don't reach target LDL-C levels with this approach, leaving a significant residual risk of cardiovascular events. Alirocumab, a monoclonal antibody that functions as a PCSK9 inhibitor, is approved for reducing elevated LDL-C levels. Theoretical considerations have been raised regarding the use of PCSK9 inhibitors in individuals with diabetes, particularly questions over the safety of co-administration of a biological agent, insulin, with a monoclonal antibody, Alirocumab, the effects on glycemic measures, and the change in anti-diabetic medication use. This uncertainty prompted researchers to investigate the efficacy and safety of Alirocumab in insulin-treated patients with diabetes, showing elevated LDL-C despite maximally tolerated statin therapy. The Phase 3b ODYSSEY DM-INSULIN study was the first trial with a PCSK9 inhibitor that specifically randomized individuals with insulin-treated diabetes at high cardiovascular risk who have elevated LDL-C despite receiving maximally tolerated statin therapy, and included 517 participants with type 2 or type 1 diabetes randomized 2-to-1 to receive either Alirocumab or placebo. The primary efficacy endpoint was the percent change in calculated LDL-C from baseline to week 24. Primary safety endpoints included treatment-emergent adverse events, laboratory data, product technical complaints, and vital signs. The results showed that Alirocumab was superior to placebo in reducing LDL cholesterol in both groups, lowering baseline levels versus placebo by 49% and 47.8% in participants with type 2 and type 1 diabetes, respectively. The researchers also observed significant reductions in non-high-density lipoprotein cholesterol, apolipoprotein B, and lipoprotein A. Alirocumab was well tolerated and did not affect glycemic measures or the dosing of glucose-lowering treatments. Also, the concomitant administration of Alirocumab with insulin did not raise any safety concerns. Overall, the study demonstrates the feasibility of concomitant therapy using insulin and Alirocumab. Using PCSK9 inhibitors such as Alirocumab to reduce LDL-C in individuals with type 1 or type 2 diabetes may offer a much-needed way to reduce cardiovascular risk.